Well, Alzheimer's is one of the most common forms of dementia. It affects more than 6 million Americans, and that number is expected to double by 2050.
Yeah, but detecting it early could really open the door to more treatments out there, and your eye doctor may be the one to diagnose you. So joining us now with some signs and symptoms to watch out for is New York City ophthalmologist and eye surgeon, Dr. Jeffrey Delarusso. Thanks so much for being with us this afternoon.
Thanks for having me. Nice to see you guys.
So this is interesting. It could start with a visit to the eye doctor. How often should people, first of all, get their vision checked, and does that vary as you age?
It does vary. People, of course, most parents hear that children should have an eye exam upon entering kindergarten. And if people aren't wearing glasses and contacts and they've had nice vision and no symptoms, it's great to have a complete eye exam at the age of 40. Which is fine unless people's needs dictate otherwise, with wearing glasses and contacts or having problems. At age of 60, people should have an eye exam a bit more frequently, every 1 to 2 years, as directed by the findings and people's symptoms at that point.
Let's talk a little bit about those symptoms. What are some symptoms a patient might notice that could indicate the possibility of Alzheimer's?
It's a bit unusual to really diagnose or pick up Alzheimer's in the eye in an eye visit, but things as vague as blurred vision, issues with light sensitivity, like if the light is low, not being able to detect movement of objects, or just general decrease in vision at night, trouble reading, depth perception issues, trouble ambulating that seems to be moving around the house, that seems to be coming from an eye issue. And then there's, classic with Alzheimer's, there's difficulties with identifying objects. That's a huge telltale sign.
So let me ask you this. Are there signs that you notice while screening patients that could really indicate that they have a larger problem?
Yeah, when you come in and, it's screening patients, a lot of people within the age group are often coming with a family member or someone accompanying, and they can kind of fill out the picture of how, people are functioning at home. But people that, their pupils are poorly reactive to light. One symptom is people that have a decreased field of vision when looking down, or just in their inferior, their lower view, which unfortunately affects walking. It can be a safety issue. A big change in the vision from when we have the lights on to when we turn them off during exams, that decrease in contrast sensitivity, especially when the lights are lower, that's a big sort of telltale clue to dig further.
So, doctor, how does catching Alzheimer early actually affect a patient?
Unfortunately, actually, there's a new drug that came out that was just announced to be quite effective a couple weeks ago, or last week, that was in the news, which can slow the pace of mental decline. I think it's 27%. Catching things early, we wish the treatments are better. Catching them really is more of a safety issue, really, I think, in my mind. Mm-hmm. Making sure that people's vision, if compromised, can be best corrected. Are there glasses that are needed? Are there cataracts, which can coexist in this age group a lot? Is there glaucoma? Right. All these symptoms of decreased vision, decreased field of vision, et cetera, commingle in the same age group. Some early detection at least puts people in the best position to have the maximum vision they can. Right. And if there's a population issue or a safety issue at home, having that addressed.
All right. Dr. Delarusso, thank you so much for joining us this afternoon and speaking with us about this.
Thanks for having me.
All right.
Appreciate
Take care.
it.